Professor Jorge OCAMPO-CANDIANI from Mexico. I'm the chairman of the Department of Dermatology in Monterrey, Mexico.
So, Professor OCAMPO-CANDIANI, do you think there are differences when you treat people with deeply pigmented skin like Latin American people comparing to white skin?
Well, in Latin America, we have different skin types from phototypes 1, 2 to 4 and 5. So we have to follow special rules when we do any kind of procedure with our Latin America patients. Before we do the procedure, we have to prepare our patient normally with the use of retinoic acid. We use hydroquinone, 2 to 4%, and always we highly recommend sun protection or with the combination with a sunblock.
What are the new techniques used in interventional dermatology?
Okay, there are a lot of new procedures in dermatology. The new era of the laser and light procedures have changed completely our practice. We have lasers for hair removal, we have lasers for tattoos, we have laser for photo damage, or we have lasers for acne scars. Right now, we are using fractionated lasers that permits rapid wound healing with a fast recovery, less downtime, and less complications. We are also using IPL, intense pulse light, that permits to treat different diseases with very good results. We also can use radio frequency devices and also with different plasma treatments that we have used in our daily practice.
What would be your specific recommendations about the use of laser treatments on pigmented or Latino skins?
We normally recommend to use long wave and with long pulse duration, and always we have to use skin cooling devices. That's the main three goals. The example we use mainly for hair removal, lasers with 1064 long wave, or sometimes we use diode lasers. That's the main laser we use for dark skin people. And always, for example, when we are treating patients for photo damage or acne treatment, we use fractionated laser, and we use high fluence, but with low density. So that's better for our recovery, and that's the better results we get with dark skin population.
And for peeling agents?
Okay, we have a lot of experience with peeling agents. So there are, as you know, different deep penetration with the peels. We have superficial, we have medium, and we have deep peels. Normally, with dark skin, we prefer to use light peels, like or superficial peel, like glycolic acid, salicylic acid, Gesner peel, and if we want to do medium peel, you can use TCA, triclocetic acid peels, but the main regulation or the main thing that you have to have in mind is to increase the concentration of the TCA. As an example, you can start 20, then go to 25, and then go to 30%, mainly with the dark skin people. And also, the recommendation is that always, if you can, to use a retinoic acid and hydroquinone before the peel, but stop it 2 weeks before, and then after 3 or 4 weeks, you have to start again with retinoic acid and hydroquinone 2 to 4%, and always use a sunblock. That's the main recommendation for the patients that we are going to perform peeling in Latin American skin or dark skin.
The last question. What would be your personal message?
My personal message is that we can perform most of the treatments, even in dark skin population or Latino skin, but we have to be very careful. We have to be very strict with our steps we follow with our patient. We have to be very strict with our patient before we perform the procedure. We have to be very strict of the indications we give to our patients after the procedure. And always the recommendation is to use a sunblock, always, always, always in our population.